Good, whatever time it is you are watching this. My name is Bree, aka the Bionic Athlete, and behind me is Kilo. Hopefully she's not too distracting during this video. And today we're going to have an episode of Coffee Talk, where I drink coffee and I talk. Anyway, so this video is just going to kind of go over what I'm doing to get the final preparations. This is the final week going into my surgery. So what the final preparations are looking like for that, to make sure I have the most, not necessarily successful recovery, but an easier recovery. And hopefully easy will lead into success. Anyway, so this is just kind of my game plan for what I'm doing, what I'm preparing for. I've talked about the three main things that I did getting ready for surgery, which was reaching out to a dietitian, getting PT put into place, and trying to work on my mindset. So this is a little more detailed than that. This is more talking about support system, getting the house ready, my nutritional needs stuff, and I don't know what else. Oh, and like simple things like clothing. So anyway, so the first one is your support system. Your support system is going to be playing a huge key role into your recovery. They are the person that is going to have to be by your side, helping you with the ups and the downs, and doing the littlest tasks, because there's going to be so many things that you might not be able to do, and your guard is going to have to be down, and you're going to have to rely on them for so much of your day-to-day that you really didn't think about, especially depending on what your surgery is. But for me, it's really going to be the first few weeks of surgery that I'm really going to be depending on somebody else. We'll call them the partner in healing, because that partner might look different for you, and who it is. So your partner is going to be playing a huge role in helping you with your day-to-day. They're like an extension of your body for you. So and with that also comes either the person who's helping you at home with your day-to-day stuff. They might also be the person that you're relying on for your emotional support too. You're going to have so many ups and downs in this recovery time, and you're going to need somebody to talk to who's going to listen without judging you, who's going to hear what you're saying, who's going to let you cry the ugly cries, who's going to let you be angry if you need to be angry. And instead of trying to necessarily fix you, because you're not looking always for the fix or the answer, because we don't know what those answers necessarily are going to be, but it's the person who's going to let you express those emotions and feelings, and they're listening, and they hear you, and they allow you to have them. They may give you some words of guidance. They may try to give you some wisdom, which is totally fine. There's nothing wrong with that. But they also need to understand that those things at that moment in time may not be what you're trying to hear. But still take them in, still absorb them, because they're also needing support during all of this, because it's not just hard on you, the person going through it, but it's going to be a little hard on your support system too. So it's going to be a back and forth. Maybe your support system needs a support system. Who knows? Anyway, so good support system. Have that in place. The person, and it may be more than one person. It may be one person who supports you at home, and it may be a completely separate person who you go to talk to about your emotions and stuff like that, and the things that you're going through. And that's okay. It may not be the same person, and you may not be able to use that same person. So making sure you have 1 to 2, 3, 4, however many support people you need, you have those people in place. The other big thing that I did that I didn't really think too much about until kind of towards the end here, getting ready, it was wardrobe. I had to get a few new things for my clothes. It is wintertime here. We are supposed to finally be getting snow this week and next week. And but I'm going to be living in shorts for the most part, and they need to be comfortable, loose shorts that are easy to get on and off with little help. Clint's going to have to help me quite a bit with my clothing, and I just wanted to make sure that what he's helping me with is actually easy for somebody to help me get on and off. So, that came down to getting different shoes, making sure my shoes that I have here are easy to slip on and off, that my shorts are easy on and off, and that any long pants that I wear are easy on and off. So yeah, I had to kind of like reevaluate my clothing for the next at least a month probably. I'm going to have a lot of restrictions since I'm getting posterior, and I'm not going to be able to do a lot of movement with my leg for the first 3 months, I believe it is. So then the other thing is getting the house ready. So that included, can I get up and down from the toilet? Can I shower okay? Can I move from my living room to my bedroom, from my bedroom to my kitchen? Like, is it going to be easy movement without having any tripping hazards? Is everything going to be down in my level so I don't have to go up and down all the stairs too often? So I'm getting like a little lap desk put into place so I can still get some work stuff done. Maybe still even potentially make coffee talk videos where I'm just laying in bed. So little things like that. My nutrition, so I met with my dietitian. We got a plan put into place to make sure that I am eating enough during my recovery time with my micros and my macros, that I have a meal plan put up so that it's not having to think too much about it, so that Clint can put my meals together for me on days that I'm not feeling up to it or wanting to eat. I'm still eating because nutrition and diet and eating and all of those food things are going to still be really important because that's going to play a huge key role in how well my body heals. So we have that put up. Weird things like making sure my house payments, my taxes, all of that stuff is kind of like put together. So it's one thing I don't really have to think about. So the house stuff is all set aside and put together. My work stuff is all set aside, put together. I'm taking a couple weeks off from coaching. In case you don't know, I'm an endurance and strength training coach. So I have that kind of for the next couple weeks. I'm just not going to be focusing on that. And lastly, planning with my physical therapist. So all my pre and post-op stuff is put into place and all my appointments are scheduled. So I just want to make this as easy of a transition as I possibly can. Of course, you can't plan and prepare for everything because we don't even know what kind of surgery I'm fully having other than it's posterior and it's exploratory revision. So I am prepared as much as I can be and to take some of that stress off myself and off Clint in this process. So yeah, that's kind of it. Those are my main things that I'm doing to get ready. I'm going to end this note with, it's not easy. I've had so many ups and downs. I mean, I even ugly cried this morning because it's coming down to the final countdown, and I'm seeing a lot of things change, and my plans for 2024 are different than what I wanted them to be, and I'm having a hard time processing that. I'm trying to deal with it the best that I can. I'm trying to stay positive, but this is not what I wanted it to be. So I have new goals that I have to set. I have new plans that I have to put into place, and I'm trying to keep my head on high. I'm trying to stay positive, and I'm not going to ugly cry on camera. But just know that I still am up, I still have these feelings and these emotions, and I feel like I'm losing what I thought I was gaining, if that makes any sense. I had big plans. I thought I was finally on a positive upward trajectory, but like I've said before, this is healing, and unfortunately my body is fighting really strong against me these days. So yeah, anyway, I'm going to end this before I start crying again. So this was an episode of Coffee Talk, and if you like these videos and you want more of them, please give a thumbs up, share, like, subscribe, all of that jazz. And I'll just keep you guys posted as we go along. We'll see what kind of videos I do after my surgery next week. So anyway, cheers, and I'll see you later. Bye.